Sutherland here, coming to you from NHAA 2023 Naturopathic Symposium. I have with us today Associate Professor Aime Steel, who is also co-director at Arkham at UTS in Sydney. Welcome, Amie.
Thank you, Emma.
I would really love to pick your brains about a couple of things, but what's a passion topic for you at the moment?
I'm really interested in how we as naturopaths share information with our patients and how we use that information to help them change their health behaviour and how the sort of information they bring to us as well, and how we value that information as to inform our clinical decision making. Because in evidence-based medicine they talk about patient preferences and values, but they don't actually talk about patient experiences as an important source of knowledge and information, whereas I know in naturopathy that is something that we do actually value.
Yeah, and I think that flow of information between, a medical practitioner, a patient, and a naturopath, we need to keep that as fluent as possible, because there's a lot of interactions that could be happening as well, right?
Absolutely, and I know that we do an amazing job of that. Some of the research we've done, which has been sort of interesting though, is that there's been a lot of research done internationally that's shown that maybe patients who are using natural health products aren't always telling their doctors about that. And as naturopaths, we've always thought, geez, you just need to do a better job, doctors, but we've started doing some research into the degree to which patients of naturopaths are telling their naturopaths about their pharmacy medicine use. Turns out we're not doing as good a job as we could be either. So there's particularly people using over-the-counter medications aren't actually telling their naturopath about the fact that they're using over-the-counter medications, even though 2/3 of those are also using herbal medicine and natural medicine supplements at the same time.
Yeah, I find that a little disturbing, which we all should. What's a tip for a practitioner to ensure that they get that information, that they don't miss getting that information? What can they do better?
Well, interestingly, what we know from the data is that one of the most important things is that the practitioners ask. And I know that sounds really obvious, but what we did find is there was a difference in their use, or in their disclosing their pharmaceutical prescription use versus the over-the-counter use. So we might need to ask a second question. Often might be asking if they're taking any medications. People might just be thinking about whether or not it's something that doctor prescribed, whereas they may not necessarily think about the Panadols and the Nurophens and the hay fever medications and things that they're just picking up from the pharmacy over the counter. Even if it is behind the counter over the counter, that might still be something that we need to know about in our treatments.
Yeah, I find that point fascinating, because I've got literally 3 or 4 patients spring to mind about, they said nothing about, there was pain medication use because it was over the counter, and they have endo and they just take it so often, it's so normalised. So you're right, this is a really important topic. We do need to get so much better at this.
Yeah, absolutely. And the thing is, we didn't know that we didn't know, until we did the research and we actually found there was this gap. And so it was an interesting point for us to think we need to think a bit more about this. But I still really like where the other research that we're doing is showing that we are still asking patients a lot more, and patients are feeling like they're sharing their experiences and it's being heard by the practitioner, and that's an important part of what it is that we take into account when we're making decisions about what they need to do for their treatment. So it does show that we do value patient care, and it's not that, and we also found when we looked at it more closely that the patients who felt that they were being seen and heard as an individual, that the practitioner was genuinely engaged with what they needed in some other elements of what we consider patient-centred care, the higher that experience was for the patient, the more likely they were to also talk about some of these conventional medicines. So the more that we practice our holistic principles, the more that we practice patient-first and individualised care and make sure that it's what the patient needs that gets the highest priority, the more likely they are that they're going to tell us about these other things.
Well, thank you for doing that incredible research, because without doing the research, we don't know where these knowledge gaps lie. Yeah. So that is absolutely critical.
Thank you very much, Emma.
If you want to hear more of Amy's wisdom, she has done quite a few podcasts for us already, so go back and have a listen to them.